Welcome back to the Morning Brew. I'm Larry Aarons. We're really thrilled to have our guests from Lovelace on the show today, particularly the New Mexico Heart Institute and the Heart Hospital of New Mexico. Let me introduce to you two special guests here at the table with us. First of all, Dr. Mark Bieniarz, who is with us today from the New Mexico Heart Institute, and you are an interventional, finish my sentence here, Mark.
Cardiologist.
There you go. Yeah, an interventional cardiologist with the New Mexico Heart Institute. It's really good to meet you. Thanks for coming. By the way, Dr. Mark is an Albuquerque native, and with us today is a New Mexico native from Chama, right?
That is correct.
This is Maria Atencio, and she is the chest pain and STEMI manager at the Heart Hospital of New Mexico at Lovelace Medical Center. Now, STEMI, S-T-E-M-I, we see it on your credits there. It's an acronym for?
It stands for ST elevation myocardial infarction. It's basically when a patient is experiencing a complete heart blockage in one of the main arteries of their heart.
Now, your job, as I've learned, is to meet that patient at the ER when they come in. They're having all the classic symptoms of a heart attack, and you're there to meet them and get them through the process as quickly as possible.
Correct, and I actually learned about them prior to their arrival to the hospital. We incorporate EMS as part of our team, so they pre-activate us, they notify us, letting us know that the patient's coming in. So we anxiously await their arrival in the ER, we welcome them, and quickly and efficiently we take them back to the cardiac catheterization lab, where they're meted by our interventional doctors and a team of specialists to help that are trained to open up that artery.
And you can both address this. Time is of the essence, right?
Correct.
I often hear about the golden hour.
Golden hour.
Yeah.
Correct. Time is muscle. Since 85% of most heart damage occurs within the first 2 hours of symptom onset, it's vital to recognize the early symptoms and seek care immediately.
So the heart attack occurs and the patient's having pain and all the symptoms. Obviously, you're trying to stop the heart attack, or you're trying to prevent the heart from getting damaged further. What's your first task there, Dr. Mark?
So the goal, if we have an accurate timing of the onset of symptoms, because a lot of times the damage is done if patients have waited too long to come in. That's where you speak to the golden hour. If you can get the artery open within 1 or 2 hours, there probably will be no long-term damage. And so time is of the essence. And what we do is we go into the artery with a wire and with a balloon and open up the artery. The artery typically has a plaque in it that's made of cholesterol and white blood cells that's stable, and then because of inflammation it ruptures and clots off. And it's that blood clot that's totally occluding the artery that we need to disrupt and open up, and then ultimately stent to stabilize the artery and restore blood flow to the muscle and allow the recovery to begin.
Wow. A lot of people confuse a heart attack with cardiac arrest. A heart attack is not when your heart stops. It's just damage to a portion of the heart.
And one of the main reasons why you would have, quote, stoppage of the heart or a heart rhythm problem is a heart attack, of course, because the electrical system of the heart is being damaged along with the wall of the heart. And so a lot of times a cardiac arrest is a symptom of a heart attack. But a heart attack is actually damage to the muscle of the heart. And the heart muscle then will release certain substances into the bloodstream that then we diagnose a heart attack through lab tests.
We're going to talk about some symptoms here in just a moment. We hear the term all the time, a mild heart attack. Is there such a thing?
There is, and we're speaking specifically about ST elevation MI today, and speaking about our program at Lovelace with ST elevation MIs, but there is a concept of non-ST elevation MI. ST elevation happens when the artery is 100% blocked, and that heart muscle is dying, and will continue to die until the artery is open. A non-ST elevation MI typically is diagnosed from lab tests as well as symptoms.
I see.
And it's there because of a partial occlusion of an artery, or it's there because the heart is going too quickly and has released heart enzymes, or there because of inflammation to the heart muscle, systemic illness. Those types of things can cause a, quote, mild heart attack.
Let's go through some of the symptoms of a heart attack, and there are a lot of classic symptoms. It never hurts to get reminded of these over and over again. We've heard them for a long time, but let's talk about them. What is typical symptoms of a heart attack?
So as most people know, chest pain is the main common classic symptom of a heart attack. Typically, chest pain beneath your sternum or your breastbone that then will radiate to your arms, radiate to your jaw, accompanied by nausea, sweating, shortness of breath. And it typically will have those symptoms with exertion leading up to that. That's the classic presentation. However, what we say is patients don't read the textbooks. And so most times people have very different symptoms. And so we have an initiative at the Lovelace system to consider any symptoms in a person that is at risk for heart attacks, being anybody that's above the age of about 18 who are coming in with symptoms between eyeballs and belt buckles to do an EKG, because that's a very cheap, very easy to diagnose and zero risk study that we can do to actually diagnose a heart attack.
So the message is actually very simple. We have to recognize the early symptoms of a heart attack and seek medical attention immediately by calling 911.
Yeah.
A lot of our patients tend to wait. They ignore the early warning signs of a heart attack. They tend to rationalize their symptoms away, or they wait till their symptoms are absolutely unbearable before they call 911.
They think it's heartburn or something.
They do. They do.
Or
Others
whatever.
will wait until they're absolutely sure they're having a heart attack because they fear that if it's a false alarm, they're going to be ridiculed by their friends and family.
Yeah, there's no embarrassment in
There's
going
no
to
embarrassment.
Not at all.
Absolutely
in fact,
not.
you guys are happy when it's not a heart attack.
Only skilled, trained medical professionals can determine if one is having a heart attack. So your responsibility as a patient is not to diagnose yourself, is to recognize the symptoms and get help early on by calling 911.
Yeah.
And the worst thing they can do is drive themselves in. We always tell our patients, if you try and drive yourself or a loved one in the event their condition should worsen while they're en route to the hospital, the worst thing they can do, there's absolutely nothing they can do for the patient.
Yes.
By placing their loved ones in the hands of highly skilled EMS personnel, they're trained and ready to respond to emergent critical situations in a timely fashion.
That's right. If you're managing one patient, and you know it's very hectic, I can imagine. Do you ever have 2 or 3 happening at the same time?
We do. That happens from time to time.
Then it gets crazy, right?
It can get pretty hectic, but we have protocols that are there in the event that should happen. We are ready and equipped to take 2 or 3 STEMIs that are coming in the door.
Good to know.
And that's also why the program that we're discussing today is in existence, to actually help coordinate in the community and to help coordinate in our hospital system how we manage unpredictable things like when people have heart attacks.
Yes. Now let's talk about this award that was given. And this is from the American Heart Association. It's the Mission Lifeline Award. We have a little graphic of it here.
Sure.
And what's that about?
So American Heart Association's Mission Lifeline is an organization that has a goal of improving the consistency of cardiac care.
Okay.
They recognize hospitals that display their dedication to the community by standardizing and creating a team approach in the treatment of cardiac patients. They require that from the time a patient calls 911 and are eye-to-eye with the EMS personnel at home until the time they receive their life-saving treatment at our facility, that this measure be 90 minutes or less. They also hold hospitals accountable for meeting and exceeding certain criteria that they set forth. The Heart Hospital in New Mexico was the only hospital in the state to not only meet these criteria, but to receive the Silver Level Recognition Award through Mission Lifeline.
Wow.
So our commitment at Heart Hospital is to create a team approach and to streamline the cross-departmental processes, incorporating EMS as part of our team in order to increase our effectiveness and accuracy when we treat our patients. Simply put, this award is a measure of the timeliness and the quality of care that our patients at Heart Hospital are going to receive.
Beautiful.
And the silver award is just simply a measure of consistency. We have a year of consistent data since we've been measuring this, and there's a big change in how we're assessing the timeliness of care, where previously, and it still is a big measure within hospitals, of, quote, door to balloon time. The patient comes in the door to the time that a balloon is up in the artery, opening the artery, restoring blood flow. That's the classic measure of timeliness of care. Now with Mission Lifeline, what we're recognizing is that there's all kinds of care that goes on before that. And it really, honestly, begins from patient recognition. And that's why being in the community, speaking to patients, and educating the population about symptoms, which is what we're doing now, and I compliment you for doing this, is so imperative so that patient recognition of symptoms can begin. And then notification of EMS is very important in the timeliness there. And so we have a measure that's actually first medical contact, being the emergency medical system, to balloon time, and that is standard is 90 minutes. First medical contact to balloon time.
That's
90
incredible.
Minutes.
This is a carefully choreographed and rehearsed thing that you do there, and
that is correct.
That's really nice to know you're there.
However, it hasn't always been. Okay? And up until recently, this is where the American Heart Association is so forward-thinking. Each of the care tiers, we'll say, was very siloed, where you had EMS that took care of EMS, and that's it. And they brought them to the nearest hospital, and that nearest hospital did what they would do and kept the patient there. And then you had the facility where they would open the artery, and these facilities wouldn't talk. They were inefficient.
Those days are gone.
Those days are gone, and we have a continuum that works perfectly and efficiently for the patients of Albuquerque now.
It's great to meet both of you. Thank you for being on with us.
Thank you.
And drop back by and see us sometime again, would you?
It's great
Absolutely.
meeting you, Larry.
Thank you.
Thank you.
That's our segment with our friends from Lovelace on the Morning Brew. We'll be right back.